Goniskill hip adduction. Assist the patient to the supine position. Make sure the knees are extended and both hips are in neutral position. Abduct the contralateral lower extremity to provide sufficient space to complete the full range of motion in adduction. In patient-appropriate language, ask the patient to adduct the hip while you assess the pelvis and one hand for lateral tilting. Apply a force at the lateral knee and adduct the hip to end range, keeping the hip in neutral flexion and rotation. As you stabilize the pelvis to prevent lateral tilting, the end of range of motion occurs when resistance to further motion of the femur is felt and attempts to overcome the resistance cause lateral pelvic tilting, pelvic rotation, or lateral flexion of the trunk. Assess the infield of the joint, which should be firm because of the tension in the superior joint capsule and the superior band of the iliofemoral ligament. Tension in the gluteus medius and minimus and the tensor fasciae latae muscles may contribute to the firm infield. You are now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. Align the axis of the goniometer over the anterior superior iliac spine of the extremity being measured. Align the stationary arm with an imaginary horizontal line extending from one ASIS to the other. Align the movable arm with the anterior midline of the femur using the midpoint of the patella for reference. Ask the patient to perform hip adduction as previously, maintaining the goniometer in alignment through the entire range of motion and observing for any extraneous movements of the pelvis. Read the degrees of motion on the goniometer and then ask the patient to return the leg to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. If necessary, assist the patient back to the sitting position. Average range of motion according to the American Association of Orthopedic Surgeons is 30 degrees.